These are corrective exercises for vibratory corrective exercises for the lateral line. So what we're going to do is we're going to put the sphere in what's called the QL. Basically lateral flexors of the spine, somewhere between the hip or the PSIS and just below the rib cage. So again, stay off the major bones here. You want to get on the flesh, okay? So you can see where Shelly's positioned. She's slightly angled her body in order to be on, and you can move your body slightly until you find that spot that's a little bit tender. Again, stuff that's taught during the course, okay? So you're going to hold this position. You can try and sort of like, try and bend your body a little bit laterally so you can actually start to, yeah, there you go. You start flexing the spine laterally if you can, but it's not necessary because the vibration will do most of the work here. So this is, again, could be activation, could be inhibition, depends on what we're working on. So that's the QL. Then we're going to move on to the cross-frictioning of the IT band. So I'll take this one. She's going to grab the Viper. So the Viper is better for this just because this ball is really hard, so you want a slightly softer piece of tissue. Again, search and destroy technique would have been used. She would have started at the bottom, just above the knee. She would have moved along the lateral side of her thigh. Generally, there's a spot about 1/3 of the way up and usually 2/3 of the way up. The greatest problem typically is 2/3 of the way up, but in this case, what she's going to do now is she's going to cross friction. So in this case, again, we're going to add vibration in here. Right? Good. Which again just confuses the nervous system ever so slightly. And then it also numbs the pain or the nociception. So oftentimes this is very uncomfortable for people. So the vibration can actually help sort of dampen the brain pain response, which is really helpful when you're trying to get into tissue that's quite sore. And then she's going to create that glide, right? And the vibration also increases some fluid production into that area. So again, also helps create glide in that area. So we're getting better blood flow, better fluid. So the glide will add in here. Again, things I'll teach throughout the course so you understand when to best use different protocols here. But as a whole, you can always use vibration to help turn off or help mobilize the tissue depending on what it is that we're working on specifically. Okay? Awesome. So now last but not least, we're going to work on the adductors. Again, this can be quite painful. She's going to trap the ball under her knee. We're going to get into what I call the sprawl position. Okay? So from here, it's a bit of both, okay? So there's a combination of either relaxing the adductor tissue, or also activating the VMO. So we're going to get a bit of surface glide. So again, same idea, same premise applies. Okay, she's going to start to kick out. And again, rather than just hang out here, I'm just going to have her bend her knee. I'm just going to guide the situation a little bit because I can help move the ball around. How's that feel? Oh yeah, I can see your face. Got it. Awesome. So she's going to kick out gently, breathe. Good. And again, I can start to change the angle. I can move the ball for her, right? Move it up a little bit higher. We can change it. Bringing the ball down a little bit lower here actually activates a specific knee extension muscle known as the VMO. And a lot of times people like start to shake here. That you might want to back off the tension a little bit, but also help finish the extension. Get that full terminal knee extension if at all possible. That's your P2P protocol.